The same is true of disadvantaged social environments, particularly where there are low levels of social capital. We also know that people living in disadvantaged environments tend to have poorer health behaviours, and they also tend to have elevated psychiatric morbidity just because of their disadvantage. And all these aspects of disadvantage interact with this basic cycle of climate change related amplified risk. And you can imagine the kind of mess that this can make and complexity in trying to work out what to do. So where might we start? What we're thinking is, because social capital sits pretty much in the middle of all of this, and we know it's amenable to modification, and we know it's extremely important, particularly for mental health, we may be able to look at that as a possibility for where we could have viable, feasible interventions. So going back to our picture of cities and mental health, what we think is that climate change is acting as a multiplier of risk and disadvantage in these key components of this relationship, and that we can use the existing theories and hypotheses to help us understand how we might develop some further research and some interventions. We're using a couple of strategies at the moment to try and work out how climate change imposes itself on these dynamics. One of them is to exploit existing data, and we do that by finding really great databases like HILDA, and then we develop and then add to those databases measures of weather disaster impact and exposure. And we also link into these databases climate change data so that we know what kinds of disasters are happening to people in particular places at particular times, and we can relate those to what the data are saying. And we've actually got some NHMRC funding to do one such study at the moment. The second strategy that we're using is to collect new data, and we're doing that in a couple of areas. One is epidemiological data, and the other is around interventions and natural experiments. And to finish up with, I'll just spend a moment or two giving you a couple of examples of those. In partnership with Queensland Health, and Sophie from Queensland Health is going to talk to us very shortly, we're working with them on their 2011 self-reported health status surveillance systems survey. This is a regular survey that they run, and the current one is in the field at the moment. And in partnership, we've devised a modified version of our traumatic exposure and impacts measure, which has been introduced into their survey. And this is a cross-sectional computer-assisted telephone interview survey. And the modules that include the weather, trauma and exposure items are going to 5,500 people, so we'll have a really nice sample there to work with. And it will cover data on disaster impact, all sorts of socio-economic and demographic factors, mental health, chronic health, health behaviours, quality of life, and importantly, social capital. And we're very, very excited about that partnership and looking forward to starting to analyse the data. The field testing of the data does indicate that they've worked, the items that we've developed have worked well. The second study is a natural experiment that we're calling Moving to Green. And the research question that we want to ask is, if you simply have people move, if people move from a brown suburb to a green suburb, is that on its own enough to affect some change, not just in climate change related behaviours, but in their health behaviours and ultimately their health outcomes? And we've partnered with a big developer in Canberra who's building a green village, and I'm using that as a shorthand for a village that's been designed to reduce carbon emissions, have housing that's very well designed, very well insulated, very solar passive, great deal of walkability in the village, paths and cycle paths everywhere, lots of parks, that kind of thing, local shops. And the developer, wonderfully, has a complete database of everybody who's ever registered to apply to buy a house in this village. And so we know where people are or were living before moving, and we also know who didn't move, which provides us with a very helpful control group. And we can do pre-measurements from them in terms of self-report and their medical histories, and also look at the walkability and greenness of their existing suburb, and then have a look again at several measurement points after they've moved. So also a very exciting study. So in terms of thinking about climate change as a multiplier of risk and disadvantage, we're using a range of adaptation projects as well as a range of exemplar impacts studies to try to better understand these very complex interrelated relationships between existing risks, existing disadvantage,